There we go. Wonderful. Yeah, as Dr. Musser said, I am Dr. Patricia Ethington. I am not a medical doctor. I'm a doctor of nursing practice. My specialty, I have actually two populations that I'm interested in. One is college students, and the other is rural populations. So I look at population health. There's another person that is looking at simulation and the best way that students can learn in nursing. But before I begin, I want to go around the room. This is a health careers class, correct? Okay. So what health career are you thinking or exploring, or do you have any idea?
I'm looking, it's kind of like between two. I'm between dermatology and being in like surgery.
Okay. So you're thinking like pre-med, pre-nursing, or okay, wonderful. Nurses, one of our graduates from nursing school, her name was Aishaya. She was from Chicago. Anyway, she graduated with her nursing license. Then she went on to graduate school, became a nurse practitioner. She now runs her own clinic, making buku bucks in Las Vegas. She does the fills, she does Botox. So nursing is not only for people who are sick, but people who want to enhance themselves. So anyway, dermatology is fun. No nights, weekends, or holidays for Ashaya. So anyway, what are you thinking of?
About like the pre-med route, either going into pediatrics or OB.
Oh, wonderful. Yes, OB is not mine. There's fluids everywhere. Wonderful. Good, good, good. I love pre-med. What about you?
Medical research.
Oh, medical research is fun. Absolutely. Get your foundation here and then go on. Lots of money there too. What about you?
Not sure yet.
Not sure yet, just exploring everything. Wonderful. In the back, I can't see you. Your son's.
Medical examiner.
Oh, okay. This Friday in nursing, part of our public health rotation, emergency preparedness, we're having a mass casualty day. But since it's going to rain on Friday, we're going to hopefully move it inside the physics building. But if you see a lot of action going on at Kearns, that's what's going on. Our corner from Peoria County and McLean County are both started as nurses. And anyway, they're now the county corners. And yeah, that's kind of cool with all that forensic file. Okay, what about you? Pre-vet, okay. I married a farmer. We have lots of livestock. Yes, I like people, not animals so much, but no, this is wonderful. Good, good, good. What about you?
Dermatology.
Dermatology, okay, wonderful. Yes.
I was thinking about the pre-med track to be a cardiovascular surgeon.
Oh, I love that. Working with the prompt, very precise. That is fun. We also have CVICU nurses. One of my friends, she's up at Rush, and she's a nurse, went on to school, become a nurse practitioner, actually acute care nurse practitioner. And her role is to close a person up after an open heart surgery. So the surgeon will do the incision, and then you wait and watch the heartbeat and get them off ECMO and all that stuff. But she is an advanced practice nurse, and after she's approved, or the patient's doing well and stable, she's the one that closes them up. Isn't that cool? So yes. What about next to you?
Pre-vet.
Pre-vet. Oh, okay. So we got two pre-vet people. Wonderful. More power to you. Yes.
I'm good at dentistry.
Oh, oral care. I don't know what's worse, vaginas or oral care. I don't know. No, we need it. Good, good, good. That's wonderful. Yes.
Physician assistant.
Oh, a PA. Absolutely. Do you know what the difference is between an NP or a PA?
Not entirely.
Not entirely. Okay. PAs and NPs are both mid-level providers. So they are not the physician, but they're not, I don't want to say they're graduate prepared. So they have more advanced education than what a nurse does. I personally would, I don't know, it just depends. PAs and NPs can function at the same level. They both have the same prescriptive authority. However, a PA has to be associated with a doctor. Whereas a nurse practitioner, I can go out and I can start my own clinic. I can bill for Medicare, I can bill for health insurance. And actually a friend of mine opened one in Cuba, Illinois, which is in Fulton County. That's where I hail from. But anyway, she has her own clinic. She does some Botox. She does the estrogen implants, but she can do that by herself. Whereas a PA, you have to be associated with a doctor. However, a lot of times your PAs are very specialized. So you can go into like orthopedics. You can go to cardiovascular. Whereas a nurse, you have a little more freedom. You can float around to the different specialties once you get your graduate degree. So yeah, good for you for thinking about going mid-level. Okay, I'm just going to cater to the people that are here in person and not the online people. Is that okay? Okay. And here's the information about nursing.
Probably increase it up here too.
Okay. Okay.
Okay.
Nope, this will be.
During the Crimean War, more soldiers died from infection than in battle. Until a nurse introduced sanitary practices still in use today. When the scourge of polio hit the world, it was standard practice to strap down and immobilize patients. Until a nurse discovered that movement and physical therapy had far better results. In the 1950s, jaundice was a leading cause of infant death, until a nurse found that a few hours of sunlight could actually cure the condition. At the dawn of the AIDS epidemic, no one knew how the disease spread, so patients were kept quarantined and alone, until nurses defied convention and embraced them with compassion. During the Ebola outbreak, the disease was thought by many to be too contagious to treat, until a student nurse used what she had on hand, garbage bags and duct tape, to protect herself so she could care for others. And cerebral palsy robbed many patients of their ability to speak, until a nurse gave them back their voices. And I will always be grateful to her.
That cool. Did you guys know that nursing was responsible for all those trends? Especially with the baby. It truly was a nurse that knew that if you took that baby outside, it was in the warmer climates. You don't want to take a baby outside that's cold. But anyway, that sunlight. We also know that the sunlight helps with tuberculosis. You need to get that vitamin D. We all know that as common knowledge. The other thing that we know as common knowledge is washing our hands. But we got to do that. And it was actually a nurse that discovered that it was in England, and the maternal morbidity and mortality rate was high. That means pregnant moms, they were getting sick. Those moms that were delivering babies, they were more likely to die or get sick if they delivered in a hospital. Well, they found out that the surgeons also did the autopsies, also delivered the babies, and they weren't washing their hands between the dead bodies and then delivering a kid. We just think that's gross, right? But no, we know about the germ theory now. And it was a nurse that says, you need to clean, we need to wash our hands. So it's amazing. As nursing, you can specialize in many different areas and make a difference of whatever your passion is, whatever you want to make a difference in. Lots of research for sure as you move on. Johnson & Johnson is a company that is huge in supporting nurses. But why do people become nurses? Here's one more video.
It starts off with my mother. She's been a nurse for almost 30 years. And just growing up as a child with my siblings, I remember the ways that she used to care for us whenever we got hurt or sick, and she always knew what to do. There was a time when I was playing basketball in high school and I broke my hand. And when she came, she, I just smiled and said that I was going to be okay. And because she wasn't worried, I wasn't worried. So when I got to college and I was just considering what majors and trying to figure out what I wanted to do, I thought about how my mom was always just cool in those emergency situations for me.
One of the reasons I became a nurse was to build a relationship with patients and their families. I wanted a profession where I would go home feeling rewarded, where I knew I would make a difference in someone's life every day.
I was influenced by an uncle that lived with my family, and he had lost his leg in World War II. He was an amputee who had a disability but didn't really act like he did, and told me a lot of stories about his time in the hospital, and that had an impact on me.
I really wanted to help people. I didn't know a lot of other professions where you could be hands-on and help people physically, mentally, and be able to have some knowledge to be able to maybe get them over a hurdle.
One of the most important reasons was to become the voice for the voiceless. And as a nurse, you become a patient advocate. There's a lot of people that don't know how to fight for their rights as a patient. So I feel that I can do that.
When I was in high school, my grandma got really sick, and my mom and I would visit her multiple times a week, and I just would see the quality of the care that she was getting there. And it wasn't necessarily because of the nurses themselves. There was just such a shortage of them. So staffing wasn't good. And as a result, the patients suffered neglect. So I ultimately just kind of saw that and was like, I feel like things could be better. Things have to be better. So, you know, people can really be well taken care of.
There we go. So why did I become a nurse? Really, I didn't know what I wanted to do when I was your age or how I wanted to move on and move forward. My mom was the one that signed me up. I grew up outside of Champaign-Urbana, home of the University of Illinois. I just knew that that's where I wanted to go to school at because I wanted to try nursing school. And what's funny, when I was growing up, I always said I never wanted to be a nurse and I never wanted to be a teacher. And what am I doing? I'm teaching nursing, right? But it's a great love. I am so glad I did it. It is exciting. The hospital environment's very exciting. That was fun for a while. However, I was ICU. So anyway, I love science. Always love science. I always love the pharmacology of how that impacts your body. Nursing's a lot of science and a lot of research. You got to make sure what you're doing is evidence-based. So anyway, I wanted to go to the best floor, and that was cardiac, or it was ICU. I didn't want to do CD ICU because that's very precise. I wanted to do the medical. Well, anyway, I was suctioning a patient. The patient was intubated. He was paralyzed from the chest down, but he could still use his hands. He was morbidly obese. He had diabetes. He was paralyzed because of a motorcycle accident, and he was an alcoholic. So anyway, he had all these comorbidities, and here he was in my hospital bed, and I'm giving all of my time and effort into him to keep him alive. Since he had a trach, I had to suction him because you can't really cough up that secretion, so you had to do that for him. And anyway, I was morbidly obese with kid number 2, and I was suctioning him, and he grabbed my bottom. I was like, oh my, I am done. It was like 2 a.m. So that's when I decided that I wanted to become a public health nurse. And the reason why is because I wanted to prevent from that person from being in ICU. Let's do primary prevention. And so that's why I got involved with public health nursing. With public health, I knew I needed to specialize in an area. And I did this through University of Illinois, Chicago, and Peoria. They had a higher STD outbreak, or a STI. So that was the problem that I worked on. And then I brought my research here. Did you know that you guys can change behavior, or you're more likely to change behavior by receiving text messages that tells you to practice safe sex? Isn't that cool? So my research was done a long time ago. I'd say 7 years ago. It's long for you guys. That was before we had picture messages, so I could only do 150 characters or less. But you guys had reported, meaning students, that you would change your behavior based on this text message system that I had, which is primary prevention, to remind you, like, oh, it's Friday night. Do you know how to access condoms? Make sure you practice abstinence. Be careful about, having sex or the parties that you may be attending. So anyway, these were carefully crafted text messages. And it was exciting to see that it did make a difference, and that health behavior can change through 150 characters or less. I'm glad that we didn't have TikToks back then, or Instagram Reels, because that'd be kind of interesting, sending out messages like that. But anyway, you can do anything with nursing. I went from critical care to public health to now teaching. It's awesome. It really is. I just love people in general. So it worked well for me. So our School of Nursing and all School of Nursings are accredited. It's required by the Illinois state law. So our accreditation agency is the American Association of Colleges of Nursing, and they actually have 140 outcome domains that we have to meet. So anyone who is in the nursing program, there's specific criteria that all nursing students have to meet. So that way, I have a lot of pre-med people. When you have to work with your nurse, you're going to know that they graduated from an accredited program. They're going to be highly competent in assessing your patient. In the hospital setting, it's your nurse that the physicians are going to listen to, because we're with the patient 24/7. A physician might just come in for 5 minutes and they might miss something, but it's the nurse that's going to say, hey, pay attention to pain control. They're having right lower quadrant pain. They might need a CT scan. It's truly a collaboration with the nurse, the doctor, x-ray, pharmacy, and the nurse and that medical team will go around and see each patient. But you know that all nursing students, especially from our program, they're quality patient or they're quality nurses. They've had to meet that certain criteria. Here at Western, we have a very robust nursing curriculum. You have to do 2 years of prereqs, heavy in biology. We do have some math in there. There's statistics, because we have to be able to read research. Definitely English. I just attended a state board meeting last week, and they were telling all nursing schools that we cannot admit nursing students unless they can read at a college level, which makes sense because of the textbooks. But we have a lot of English as a second language. Western, we're okay, because you got to do 2 years before you can get to the nursing program. But other programs, they're going to have to readjust their curriculum. NCLEX passage rate. So you do 2 years of prereqs, your chemistry, your math, your social sciences. Then you got to apply to get into the nursing program here at Western. You have to do that for other places too. Once you're in the program, you will graduate with a baccalaureate science of nursing degree, a BSN. That does not guarantee you to be a nurse. You have to take the NCLEX exam. All nurses in America and Canada have to take the NCLEX exam. So that is basically a test that means you are at the basic level, that you're not going to hurt anyone essentially. But anyway, you got to take the NCLEX exam. Your schools of nursing are actually evaluated based on the number of students that passed that test the first time. So it's high stakes testing essentially. We make sure our students are prepared. In 2020 or 21, we had 100% pass rate. There was only 2 other schools in Illinois that had 100% pass rate. We are consistently 93%, 96%. Our June report showed that 14 out of 14 of our graduates so far were passed NCLEX. I have heard from all my graduates except one. So right now, we're looking at 96% pass rate for the 2023. So that is awesome. I mean, we have a good, competent program. I feel comfortable knowing that if you come into my program, you guys are going to graduate and you're going to pass NCLEX, which is a big deal. Job placement, 100% job placement. You can find a job anywhere. That's not an issue. If you don't want a job, you don't have to get one, but 100% placement. You can go in the hospitals, you can go in the clinics, you can go anywhere with a nursing degree. Some of my alums are now doing health insurance, doing that case review. There's quality control. You know, now that I'm a little bit older, I don't need the adrenaline rush of somebody crashing on me. I don't need the blood squirting out or people vomiting on my shoes. I know that's a little dramatic there, but you know, that was fun when I was younger. I'm good to have a nice steady pace. I'm happy to have people that are healthy. Nursing's not always for sick people. It can be for healthy people too. Our program also prepares you for graduate school, such as your mid-level providers. They actually want your mid-level providers to have a doctorate degree now, just because there's so much going on with healthcare. The research constantly changes. They want to make sure that you can read research and you can apply that research. So we do prepare you to move on. 2 of our graduates from Western Illinois University actually decided to go a different route and decided to go into medicine. One went into MD school and the other one went to DO. The one still that's an MD school is still in that process. The DO, the doctor of osteopath, which functions the same as an MD, is in emergency medicine up in Milwaukee. Have you talked about MD and DO?
Yes, we have.
Okay. So anyway, it's kind of interesting. Both of them were males, and they both were thankful that they went into nursing because they had that background. Because it's kind of scary going into a patient's room. And then at UIC, because I'm tied close with them, two of the pre-vet people, they couldn't get into vet school, so they decided to go into nursing school. So anyway, there's an option. And if you don't, okay, this is bad. If you're a nurse and you don't like people, we recommend that you go into OR because the person's knocked out. You don't really have to talk to them. That sounds bad, but there's roles for an OR nurse. There's something for everybody. The other nice thing about our program is that you're going to be placed with faculty that know what they're doing. You know, I'm the public health expert. I've done some critical care. I would never teach OB. Nope, I've never practiced there. I don't enjoy that area so much. However, we have a wonderful person that does like OB. I might go into that class and teach about STDs because I do like STDs. That's pretty cool. Not to have them, but, you know, to talk about communicability and how to treat them, how to treat the partner, you know, and also with STDs, you have like LGBT issues that are different than heterosexual issues. So I love that cultural diversity that you get with that population-based care. But anyway, the faculty, they are true experts in that area. They'll do extra research on that. And then since they're faculty here, they do extra education to make sure we know how to teach. We don't do lectures in nursing school. This is a lecture format. We do case studies. We do experiential learning. I can't say it right, but it's basically active learning. We put you in groups. There's lots of hands-on opportunities that you get to do. We do lots of simulations because I want you to be competent in your skills before you go out to the hospital and do it on a real person, right? Flu shots. How many of you guys have gotten a flu shot, or do you think you're going to get a flu shot this year? Oh, look at that. Okay, when you go to the WIU flu shots, you're actually going to have a student nurse give you the flu shot. Don't be scared. The faculty member will be right there with them. And really, you guys want a student nurse because they take their time. They make sure you have the appropriate dose. They're going to clean your arm. They're going to follow everything to a T. Where sometimes you get an older, experienced nurse, they're just going to, you know, shoot you, and they're not going to take that extra time. Also, you're going to have a nursing instructor look over that person, you know, to make sure that they're safe to get a flu shot. I do get my flu shot every year because, you know, I'm in a college environment. You guys share germs all the time. You guys live close together. You guys go out. So anyway, I am a proponent of that, but I'm not going to shame you if you choose not to get a flu shot. You know, I do believe that health is your own choice. And so I do encourage that. But if we're in the middle of an outbreak of pertussis or anything like that, I do hope you stay away from everybody else if you didn't get that shot. Because it's not fair to you, to me, if you don't get your shot, but you infect me. So just, you know, be conscientious, okay? If you don't get a shot, just be cautious of others around you. Nursing is a profession. It's not a career. Once you go through nursing school, you think about germs all the time. You think about your environment. It's just a different way of thought. You know, when I take, like, maybe it's a jar of pickles at home or mayonnaise, instead of putting that face down on the counter, I always put it face up. So that way I can keep the inside of my mayonnaise jar clean. And then also I don't get my counters dirty. You know, I mean, did you guys ever think of that? I definitely think of washing my hands all the time. Definitely want to wash my hands. My hair, you know, I'm trying to make sure my hair doesn't get in my mouth because I need to pull it back. We did find people with respiratory illnesses if they're smokers. Not only is it because they're smoking, but when they put the cigarette or the vape up to their mouth or smoking other stuff, you spread germs that way. So anyway, you just think about your actions and your behavior of what's going on. So nursing does change your perception and how we interact with each other. We do have to follow the Nurse Practice Act. Each state has their own Nurse Practice Act. Illinois is actually one of the more stringent states. We were the last ones that allowed nurse practitioners to have the ability to prescribe narcotics. Texas has been wonderful. They're able to have their own standalone birthing centers. In Illinois, if you're going to be a midwife that delivers a baby, you do have to be associated with a physician unless you're a lay midwife. Oh, that's something. You can have a nurse midwife or a lay midwife. A nurse midwife, went through nursing school and has their graduate degree in maternal and infant health. A lay midwife would be a person that does not have any medical knowledge, but followed other people and they do home births. So anyway, if you're into home births, make sure it's a nurse midwife and not a lay midwife. But anyway, we have different Nurse Practice Act rules. A rule that I have to follow is I have to have 22 hours of continuing education every 2 years. Nurse practitioners, I think they have to have 50 hours. And I believe 10 of those hours have to be about pharmacology. So anyway, the Nurse Practice Act has your rules set up. If you have a felony, you cannot become a nurse. You actually get your nursing license removed. So make sure you think smart, no drinking and driving and killing anybody. We do have to follow the rules of accreditation. So the School of Nursing has specific rules. When you come to clinical, I cannot let one instructor take more than 8 students at a time. That's against our accreditation. If we do, they will yank our program away from us. It's that quality control. We want to make sure you know what you're doing. There are other rules of accreditation. I have to document that each student has met those 140 competencies. Isn't that crazy? 140 of them. We have a big Excel sheet and we have to throw all that information in there. And then we also have to follow the rules of the clinical agencies. So personal, how many people have tattoos? Okay. Dr. Messer, do you have a tattoo?
Sure.
No? Okay.
Scars.
Oh, you have scars, surgical scars. One of our clinical agencies does not allow us to have tattoos, so we actually have to cover it up. I don't know, maybe it'll change. Maybe the cities, the more urban areas don't have that rule, but we have to follow that. Another one is piercings. If you have like an eyebrow, a nose, you can't have piercings. I send a group of my students, do I have till 12:50 or how much time do I have? Okay. I send my students to Smithfield Fresh Meats in Monmouth. Do you guys know what Smithfield is? You know what Smithfield is? Okay. They are a hog processing facility. You're thinking, why in the world am I sending my nursing students to this meat processing facility? Well, one, they have 2 occupational health nurses. They make really good money. But one, they're there for patient injuries. 2, they have people. They have over 1,400 people there. There's there's many languages there, but there's 3 main languages: French, Spanish, and English. And our goal is to keep them healthy. But anyway, when I send my nursing students, they are not allowed to have any piercings because they don't want to transmit any diseases. So it's kind of interesting, even though it's this meat packaging facility and processing, we got to make sure we take out the piercings to go to that site. But also at the site, there's people that are not as highly educated as you guys, so they may have diabetes. So my nursing students are going up there to do a health fair about diabetes. And it's kind of interesting. Some of my students are bilingual, so they're able to communicate in Spanish, or they're able to communicate. I actually have one, it was actually 2 years ago, that was able to communicate in French. So anyway, we go up there and we try to keep their employees healthy. Plus they're on the meat packing line. If you're up front in the actual process, you're literally working 3 feet away from each other. Think about when COVID hit, they couldn't stop processing meat because we needed to eat in America. But anyway, we had to decrease the communicable disease, the spread of COVID at that time. So anyway, the nurses up there were huge and keeping their employees healthy, making sure everyone was safe and getting meat out to everybody. Nursing school is a lot. You do have faculty that provides you the guidance. They give you the expectations, but you have to make it happen. We can't hold your hand. We expect you to come to class knowing the information so you can apply that case study. So if it's a certain pharmacology topic that we're having, or maybe we're talking about ostomies and stomas, you need to know how to do that ahead of time so we can apply that knowledge. Students that don't come prepared, they don't do well on the exams. It's not something that you can memorize and get rid of. You got to retain that information, and then it's built each semester. Again, we'll provide you the guidance, but you have to make it happen. Our juniors, so you come in as a junior, they were really struggling with the medical terminology. And they'll ask, well, what does this word mean? What does this word mean? We can't tell you. You know, that was part of your criteria to learn those medical terms. And then when it comes to them applying those terms, like what is left lower quadrant pain, you know, what would you assess for? Well, they have no idea if you don't know what left lower quadrant is and what might be in that area. You are also assigned a mentor, a faculty mentor in the nursing program. So you will write a paper each semester. So we want to make sure with nursing, you can also write. You know, generally nurses are pretty good communicators. We like people, but we also need to make sure you can write appropriately. We don't know where your job's going to be later on. And through the writing, we can use reflection. A lot of reflection of how do you feel about a certain situation. With our mass casualty drill that's coming up this Friday, we actually have body bags. I'm not putting any people in the body bags, just our mannequins. That would be a little too traumatic, but we have to debrief the situation. Well, how did you feel when the coroner came and put these mannequins in the body bag? How do you think you'd feel as a nurse having to put a sheet over a deceased person? So anyway, we have a knowing paper person, so that way you can do your reflections and you can share any like traumas that you may have or experience. Some of our students, they have a hard time with people who are dying. We've all had patients that die. For me, the hardest part is closing their eyes. You know, they will die with their eyes open. And so anyway, generally I have another nurse that go, can you close their eyes for me? And then I'll go clean them up. But nursing, we're there from the womb to the tomb, all the way. You can do what you need. Admissions into our program. So we have pre-nursing. Those are your prereqs, your math, your sciences. Then once you complete those or in the process, then you apply for nursing school. We also have a track called the RN to BSN completion. So some people can go to a community college and get their nursing license, but hospitals are requiring that you have your baccalaureate degree. So they'll have to come back to school and get their baccalaureate degree. There's another, we don't offer this way into nursing school, but there's another way is if you already have a bachelor's degree, you can go into an accelerated program. UIC, Edwardsville, they provide that, and some of your private schools, I know Rush and Loyola provide an accelerated program. So you can get your nursing license that way. Or if you already have a master's, you can also go through that route. But the really neat thing about nursing, to get that initial license, we all have to have the same courses. We all have to have OB, we have to have pediatric content, community, leadership. That content you have to have, pharmacology. So that's why even if you have a bachelor's in another area or a master's in another area, you have to come back and get your license. So anyway, if you guys decide, my pre-vet's back there, bachelor's degree, you can either start over and come to our RN program, or you can do an accelerated program. So here's pre-nursing. You guys would not be direct admits, but if you have any friends, let them know that if you get a 1160 on your SAT, then you can come right into the nursing program and we'll save your spot. But the thing that gets everybody, in order to be in nursing, even if you're a direct admit and you have a good ACT or SAT, you have to have a 3.0 GPA. Can't be 2.99. And I'm serious on that. Cannot be 2.99. Has to be a 3.0, and you have to have a C+ or better in all your classes, especially anatomy and physiology, micro. Oh, you would definitely use micro, but you have to have that. Otherwise, you can't reapply. So what happens if you don't get a good grade in your A&P class? Take it over. I believe our university does credit retake, and they don't average the two. They'll take the higher grade, or take it in the summer at a community college because we need 2 semesters of A&P. So anyway, just so you know, that's what it is. Oh, Western's actually pretty smart too. We have a CAS. This is a centralized application system. It's through our accreditation agency. So not only do you apply through nursing school through Western, you apply through the CAS system, and that will send you nationally. So that will tell you, okay, you may not be able to get into Western's program, but hey, there's a program in Colorado, or there's another program out east that you would qualify for. It does cost $50. You do have to use it to apply, but it's nice because you have all these other programs. We're getting a lot of students, I wouldn't say a lot, we're getting a handful of students from Colorado because there's a pre-nursing program out there that matches up with our requirements. So it's kind of nice. It expands our program itself. Actual nursing school is 2 years. Some people do take it in 3 years just because it's so much information. We do require travel. There's not a lot of opportunity in this immediate rural area for clinical sites. Plus, we want you to have good experiences. So we'll travel up to Galesburg, to Springfield, to Quincy. And actually, that's a good thing, guys, because you get to see how Galesburg and OSF does it. You'll get to see how Blessing does it in Quincy, and then also Springfield. There's different charting systems, and you'll get to see how people do nursing just a little bit different. We still use sterile technique, but maybe our approach to patient care, maybe when we leave the room, is there anything else I can get for you? Or maybe they want to have communication as their key thing. They want to make sure their whiteboard is updated of how can you get a hold of me? What if you can't get into a nursing program here at Western? Know that there's something for everyone. Or what are you going to do if you can't get into medical school? There's always something else that you guys can do. I want you to stay here. WIU does have a paramedic program. You have to be an EMT first in order to do paramedic. But we're trying to do more with the paramedic program here. We have emergency services. That's an interdisciplinary care. So there's lots of different, lots of different disciplines have to work together with emergency preparedness. You have to have psychology, especially for the aftermath. You have to have us nurses and paramedics for quick response. We need to know environmentally what's going on when it comes to emergency disasters. Anyway, emergency is awesome. We have health sciences, computer sciences. Healthcare is all technology now, all technology. All of our IV pumps that we use in nursing school have the medication drag guide in them. We have all these steps. We have technology to make sure our patients are safe. So anyway, think about computer science, health education. We need really good health educators in the school systems, or even in the public. We need health. Social work, sociology, psychology. There's something for everybody when it comes to nursing. So if you don't get in, it's not the end of the world. What are you going to do if you're struggling? Ask for help. Math science tutor. We have a writing center. Each department here at Western tends to have a tutor, even for you guys. Ask Dr. Musser yesterday, you guys have a biology person, right? That helps tutor. And I know they have one in chemistry. But that is really cool at Western. We want you to be successful. I can't remember who I was talking to yesterday at Discover Western, but sometimes your better students are not the number 10s. It's the number 8s or 7s because they know they're not a 10 academically, but they work their butts off to be number 10. You have to have that grit. In nursing school, sometimes we don't put our GPAs on our resumes because sometimes those with the highest GPA don't have the best bedside skills. They're very analytical. They're going to be more your cardiovascular nurses. They're going to be evidence-based. That's who you want your bedside to save you. But they're not going to be the type to hold your hand. So anyway, it just kind of goes everywhere. There's something for everybody in nursing. I am running out of time with 10 minutes. What else do you want me to talk about, Dr. Messer?
Well, do you all have any questions? Maybe?
Yeah, the dentist person. Okay.
What's the main difference between RN and BS?
Oh,
Besides
that is a great question. Thank you. RN means I'm a registered nurse. It means I have the actual license. So I can get my actual license by going to a 2-year community school or through a college or a university for my 4-year. A BSN stands for a Bachelor's Science of Nursing. That means I have my 4-year degree. Okay, so this is what's really messed up. So nursing, yesterday a recruiter was coming. She wants a nurse for a long-term care facility or a nursing home, $40 an hour. No benefits, but $40 an hour. That's a lot of money, but you have a lot of patients. Anyway, they just want an RN. So a person who graduates from Spoon River College's program with 2 years and passes NCLEX, they will make the same amount of money as me with a 4-year degree that has an RN degree. I know, isn't that interesting? Think about NICU. No one said they want to do neonatology with the newborn babies. People are thinking, oh my goodness, if you're a NICU nurse or a CVICU nurse, they should get paid more money. No, when you're in the hospital, all nurses have basically the same starting wage. Isn't that interesting? So in nursing, we don't really, what do I say? We value every role of nursing. If you're caring for elderly or for a little infant, if you have critical care or med surg, we value everybody. And so our pay is the same. I know, isn't that? And people just think, oh, that's interesting. It doesn't matter if you have a 4-year degree or a 2-year degree, as long as you have that nursing license. It is harder for your 2-year degree people, like your ADNs, to pass NCLEX as opposed to your baccalaureate prepared nurses. So the RN stands for a license, a BSN stands for your degree. Good question, thank you.
And then you mentioned nurse practitioner and that doctor, and is that often not a doctor, and how much would they be making probably?
Okay, they make really good money, so it just depends what area of advanced practice nursing. So an APN is advanced practice nurse. Right now you can do like a nurse practitioner, which is your mid-level providers, like when you go to see your primary care, like your doctor, you have that. You can be a nurse practitioner in the hospital program. Generally, those are called your critical care registered nurses. You could be a CCRNA. Anyway, those are your nurse anesthetists. Those are the ones that will put you out. I put like a gas vest on me and give you, anyway, they're with surgery. Your CRNAs, your certified registered nurse anesthetists that put you out, they can make almost up to 200,000 or more, especially if they have to float. Yes, that's a lot of money. Yeah.
In the Johnson & Johnson video, somebody's credentials were PACURE. What is that?
PACU is PACU, Post Anesthesia Care Unit. My girlfriend is that right now that I went to grad school with. I know what people ever, can you tell I love people? Everybody has a little bit of knowledge. So she's at Barnes. She has over 100 and some odd PACU beds, post anesthesia care. When you come out of anesthesia, out of the OR room, you're at critical risk for respiratory failure, for bleeding, and you can't advocate for yourself because you're loaded up on drugs. So a PACU nurse is generally 1-to-1. So I would be taking care of you by yourself for that first half hour. And healthcare is a business. I don't want to share that side of you. But anyway, for that first half hour, you get billed every 15 minutes. And then after that first half hour, then I'm going to go and do quarterly checks on you, meaning every 15 minutes, then every half hour, and then every hour. But that just means that she's certified in that area. And generally in nursing, you're certified in every specialty. So that way you know they're competent, they have that quality. Like a wound ostomy nurse, I used to like all that gross stuff. But if you have an ostomy, you can be certified in that because there is a trick to making sure, getting that ostomy, making sure it stays clean and pink. Because that's gastric fluid. If that gets on the skin, that's going to erode that person's skin and it's going to cause more problems in the long run. Or if you get the bag too tight, you're going to cut off circulation to that stoma and then you're going to cause more problems. You got to be very precise. You got to know what you're assessing. And as an RN, you have the broad knowledge of a lot, but you're not specialized. So that's why you want to go on to grad school. And now they want you to have your doctorate in nursing practice. So that way they know that you're competent in that area. Yeah.
So to become a nurse practitioner, would you just have to be a nurse like for a while before you would move on to your like graduate level degree?
Good question. You can graduate with your BSN right away, and then you can start right away as a nurse practitioner in the graduate program. Yes, because you're going to have your own clinical hours. Okay. A lot of people find that they want to take a year off, and that's kind of the bummer of nursing and being an academician, because back then I had to work as a nurse, so that put me behind in my research, you know, compared to you were able to just probably go right on through. But I chose that because I wanted to test out my skills, you know. But no, you can go ahead and go on through. The one place you can't, there's two places in nursing you can't do that. One is to be a midwife. They want you to practice in labor and delivery, delivering babies for at least a year. And then to be the nurse anesthetist that puts you out for surgery, you have to be a CVICU or a critical care nurse for at least 2 years before you can apply. And like it's critical care, like a MDH at Galesburg doesn't count. It has to be at a bigger facility that does art lines, swan gang catheters, ECMO. You got to have those advanced skills. Like I don't even know how to do ECMO. That was just coming out. It was only neonates that use that. Good question. Another thing that's nice about nursing, like for me right now, I don't have to worry about nights, weekends, holidays, and I can't kill anyone. My students can, but I can't. So that's one reason why I enjoy education. I don't have that stress. I don't make half the money that I would in practice, but I'm happy. I chose my family. My husband's a farmer. My kids do the FFA, 4-H, all that fun stuff. And so that's what I chose. But with nursing, if I want to go back, I always thought about practicing in hospice care. You know, that'd be kind of cool. I want to put people out of their pain. I don't want to kill them, but I want to make them comfortable before they transition to that next stage of death, you know, and educate the family. I'd be the angel of death. No. What other questions? Yeah.
After like certain amount of time, do you have to renew your license?
Great question. I only have to renew it every 2 years. I never have to take that test again. I have to make sure in Illinois that I have 22 continuing education hours every 2 years. My license only costs $90 every 2 years. If I was in Iowa and I had an Iowa address, they are a compact state. That means even though I have an Iowa license, I can practice in Missouri. I can practice in Minnesota and the Dakotas, which is really nice. Illinois is not a compact state. Remember I said Illinois is kind of difficult? Mm-hmm. Yeah. So anyway, we're not. So if I want to practice across the border like in Missouri, I have to apply for a Missouri license. But I never have to take that test again, thank God. Yeah.
Well, thank you so much, Dr.
You're welcome. Thank you. Coming in meeting for all. Okay.